You've probably seen a video from Dr. Berg, who has been making some pretty bold claims about how doctors have lied to you on 9 different topics, from drug side effects to different foods or diets to even obesity, high blood pressure, and diabetes. This video has gone viral, and this is not because his claims are true and doctors are finally revealed. Listen to me, everyone. When it comes to your health, half-truths can be just as dangerous as outright lies. His video is a perfect example on how misinformation spreads in our digital age. Why? Because his video is mixing some scientific facts with unrelated explanations, oversimplified concepts, and personal theories, creating a confusion mix that will be very hard to untangle for someone without medical background. He was even inspired to say, "I will get attacked for this." But I'm not here to attack Dr. Berg, as I do not know him personally, and it seems that there are many people that love Dr. Berg's content. However, in my video, I am going to break down his claims one by one, and we will separate the facts from the fiction. We will explore the real science behind these issues, and I will give you a full picture, not just some attention-grabbing half-truths. And if you are asking, who am I? I'm Dr. Diana Garnita, a board-certified internal medicine and rheumatology specialist here in the US with over 20 years of clinical and research experience. I hold a PhD in immunology, and my research has been published in very respected medical journals. You can easily verify my credentials, and you can find my published work on PubMed or Google Scholar. I currently run my own clinic. I diagnose and treat patients daily, and my patients' review and my professional history are available online, which will reflect my commitment to quality medical care, to scientific value, and in advancing the field of integrative rheumatology in people with autoimmune diseases. Now let's begin. First, in his video, Dr. Berg accuses doctors, the medical system,
Doctors, it's the system behind doctors.
He even accuses doctors of being influenced by the food industry to prescribe medications. He says that doctors are not in favor of certain diets because they don't have enough training in nutrition. Here, I have to give credit to Dr. Berg when he suggested that food is the best medicine, but it's not the only thing that matters. Some people that eat well, exercise, and sleep enough, they still get sick, and sometimes they get very sick. Why does this happen? There are several reasons. Our health depends on more than just what we eat. Our genes, which we inherit from our parents, harmful substances that are in our environment can also make us sick. And there might be other reasons that we as doctors, we haven't figured it out. And this shows us that staying healthy, it's actually very complicated. But I'm a strong believer in the power of the food and the correct nutrition, and I promote it everywhere, to my patients, in my YouTube channel, and in my books. And I agree that we as physicians, we don't have too much education, but more and more physicians are getting training in nutrition, and I did that myself. I have to agree with Dr. Berg then when he says that
The training in nutrition and food therapy is virtually absent in medical school. They get, I think, 12 to 20 hours.
I know this is widely recognized as being insufficient, but to address this gap, many doctors in these days are pursuing additional education in lifestyle and integrative medicine. Let me give you an example. Dr. Andrew Wales' program at the University of Arizona, or other science courses promoted by Harvard or by Stanford University. Then Dr. Berg claims,
Many doctors have opinions on nutrition, which is not very favorable.
again, this is partially true, because many doctors will tell their patients about the value of nutrition together with a verified standard treatment, but they might not be trained to give you specifics. And that is why we have people specialized in nutrition that we call nutritionists, and many patients are referred there. And maybe that is not what the patients would like to do, to see another person. But wouldn't you prefer to see someone that will have the time to dig into your specific food preferences, your cultural background, and understand how they can optimize your nutrition plan? Instead of doctors claiming that they know it all, shouldn't they teach the patients what they know the best?
So let's dive into the 9 lies that your doctor told you. Does a drug actually create health, or does it numb or alter a symptom?
No, the drugs do not create health, but the drugs are not used in healthy people. Yes, many drugs are there to address certain symptoms. And the reality is that many of the drugs that we have today are not able to cure diseases. The only drugs that cure something in medicine are antibiotics because they can cure you from a bacterial infection. But let's think about this. There were diseases that were killing people 10, 20 years ago, and now we are able to keep them under control or keep them from progressing. And many of the drugs that we are using today for diabetes, high blood pressure, for cancers, and even autoimmune diseases are the result of many, many years of research. Please realize that many drugs, even the aspirin, the acetaminophen, the ibuprofen that you take for a headache or menstrual cramps or even for arthritis, those are also the result of many, many years of research. And while they can all potentially have side effects, let's not ignore that they also have benefits. Think about how many of you use aspirin to reduce the risk of stroke or heart attacks. Think about the drugs that are keeping patients with cancers alive today. Think about the immunotherapy that is saving people from lymphoma or multiple myeloma from dying. Think about the biologics that we use in people with autoimmune diseases like rheumatoid arthritis. These were patients that about 20 years ago, without these drugs, they were in wheelchairs. And now think about those people that were suffering from these diseases 100 years ago, 200 years ago. If they had access to these drugs that we have today, do you think they will hesitate to take them?
Another problem with the medical profession is it's over-specialized.
Again, this is also partial true and partially valid because being supra-specialized is not something necessarily wrong. Although you have a great relationship with your family doctor, do you want your family doctor to treat you for cancer or perform a heart surgery? Being over-specialized in medicine and in any field will give you the opportunity to dig deeper into a medical problem. I cannot claim I know it all, and I'm specialized in autoimmune diseases and arthritis, but I will never claim that I know to treat someone from cancer or a digestive problem, or I will claim that I know how to do a surgery. Although being over-specialized, you lose some of the big picture. It will help patients with specific problems to be addressed to the deepest detail.
You don't need a gallbladder, so if you're missing it, it's not a big deal.
First, a gallbladder is a sac that collects, stores, and concentrates the bile salts, but it doesn't produce the bile salts. Your liver will constantly produce bile when you eat a meal. Then Dr. Berg gives you the explanation of what bile salts do, but it doesn't explain you what to do if you have a gallbladder disease. He actually forgets to mention that you don't need a gallbladder to live. For people that have gallbladder issues, like repeated episodes of gallbladder infections or gallbladder stones that will battle many episodes of abdominal pain, discomfort, it is better to remove it. No responsible surgeon will propose to a patient to take out the gallbladder if that is functioning normal. This statement, "you don't need a gallbladder," is half of the phrase that is used by these so-called lying doctors. And now, isn't it interesting that on his website he also sells a product to help your gallbladder? Research shows that the intestine will adapt and will regulate the secretion of bile after the gallbladder is removed. And the production of bile salts is not changed by the removal of the gallbladder, but it would rather be continuous, and they will not be stored because you are missing the gallbladder. They will be more diluted, so not so concentrated.
Number 2, statins have minimal side effects. That is completely not true. They have major side effects, not just a little problem with muscles, but a major problem with muscles. Your risk for type 2 diabetes goes up, and you're at risk for liver damage.
So again, this is half of the truth. Although I agree that statins, like I said, many other drugs, including Tylenol, aspirin, and even supplements that many companies will sell, can have side effects. Now, statins can have side effects such as muscle pain, diabetes, and liver damage, but let's talk about how frequent are these side effects, and also something very important, why are statins recommended by doctors? Now, as a side note, I am a doctor who diagnoses and treats patients with muscle diseases even from statins. I even publish a case report on a statin-induced muscle disease. So you're not going to accuse me that I don't believe in these potential side effects. So some patients will report muscle pain, muscle weakness, and in rare cases will have muscle breaking down that can result in high muscle enzymes in their blood. We call this CPK or creatine kinase, and even in even more rare cases or more rare situations, they can cause autoimmune diseases of the muscles. Now, severe cases of muscle breaking down are reported in about 0.1% of people. Once again, 0.1% of people. For all statins, muscle injury risk correlates with the dose. Let me give you an example. Simvastatin. The incidence of myositis or muscle disease was 0.02% at 20 milligrams per day, 0.07% at 40 milligrams per day, and 0.3% at 80 milligrams per day. A study from 2020 who analyzed about 60,000 people with a vascular disease, not healthy people, they identified 171 cases of severe muscle disease where the muscle enzyme was 10 times more than normal. They have shown that there is a combination of factors that will lead to an increased risk of severe muscle disease. And they are a higher simvastatin dose, being a female, being Chinese, older age, lower BMI, and taking medications for diabetes or taking other medications like niacin, verapamil, beta blockers, diuretics, and diltiazem. So if you have some of these factors, yes, your risk will be higher, but again, not all patients will develop muscle inflammation or muscle disease. Now let's move on to the other side effect that was mentioned here, that statins cause diabetes. What is the real risk of a statin causing diabetes? First of all, understand that diabetes is a horrible killer disease and it's silent. People with diabetes have a higher risk to develop heart disease, actually 4 times higher. They develop more heart attacks, more strokes, more peripheral vascular disease, and they also develop kidney disease. But when it comes to heart disease, diabetes is a major risk factor for these diseases. If we as doctors don't do anything to reduce the risk of heart disease in a patient with diabetes, and this is called primary prevention because we are trying to prevent the heart disease, that means that people with diabetes will develop heart attacks and strokes. Ideally is to treat diabetes and reduce the risk, and nutrition has a significant impact on people with diabetes. But what if nutrition alone doesn't help? Then we will try to prevent complications from happening. Yes, based on current studies, statins do increase the risk of diabetes, but the risk is small in people without prediabetes. And like for muscle disease, the risk is increasing with the dose of the statin. The Jupiter trial, which was a randomized controlled trial, showed us that people with multiple risk factors like metabolic syndrome, a higher hemoglobin A1C, a BMI higher than 30, all of these being pre-diabetic risk factors, in those people, the use of a statin showed a 39% reduction in heart attack, stroke, or death due to cardiovascular disease. They also showed a 17% reduction in total mortality, but they did show a 28% increase in diabetes. What does it mean? In those with diabetes, 134 vascular events were avoided for every 54 new cases of diabetes recognized. Now, in contrary, people without any of these factors, any of the risk factors for diabetes, in those people, the use of statins resulted in 52% reduction in heart attacks, stroke, and 22% reduction in total mortality. And guess what? No new cases of diabetes. So, the increase generally occurs when you have pre-diabetic risk factors. People with pre-diabetes or people with diabetes may see their blood sugars increase when they take a statin. But the benefit of taking the statin likely outweighs the small risk to have the blood sugar level go up. Now, what is the real risk of liver disease? Liver disease is such a broad term. Statins can cause increases in the liver enzymes in 0.5 to 3% of patients, but rare episodes of severe liver injury have been seen or reported, and they appear usually in the first 3 to 4 months after you start the therapy with statin. Now, in 2012, the FDA revised its labeling information on statins, and they started to recommend liver functioning testing prior to start the therapy with statins and to repeat it only if you have clinical indication. Now, what do we do if we see a liver enzyme increase? We usually lower the dose of the statin. More than that, Dr. Berg mentions to you the role of cholesterol in the body, which is true, but the problem is that doctors do recommend a statin when cholesterol is too much or too high, not in the normal range. Too much cholesterol happens not only because of the diet, it is many times because of your genetics. So let's go back to understand where statins are needed. Statins are given when the LDL cholesterol is high. Now, LDL cholesterol is the bad fraction of the cholesterol that he is mentioning. Statins also increase the HDL cholesterol, which is the good fraction of the cholesterol, but this is dose dependent. So higher doses are more effective to increase that fraction. But it's not always about the HDL and LDL. Statins decrease the triglycerides, which are also increased in some patients, and that will increase their risk to develop heart disease. But let me answer a question. When do we recommend statins? We do recommend it for primary and secondary prevention of cardiovascular disease. Primary means that we recommend them before a heart attack or a stroke, and secondary means that after you have a stroke or a heart attack, then we recommend it for preventing further events. And the reality is that when statins were introduced to the market, they significantly reduced the need for cardiovascular surgeries. Now, heart surgeries like bypass or placing stents decreased by 30 to 40%. Carotid artery surgeries went down by 20 to 30%. And other vascular surgeries, such as those for peripheral artery disease, they also decreased by 15 to 25%. And after many studies, in 2018, a meta-analysis that included 130,000 participants followed over 17 years concluded that long-term statins treatment is remarkably safe with low risk of clinical relevant side effects.
Hypertension is really too much salt in the diet.
Now, Dr. Berg is questioning salt as the cause of high blood pressure. Then he goes on to explain you the role of salt to regulate sleep, and then he proposes to take potassium to increase the amount of potassium in your body. Excess salt has an important but is not the predominant role in elevating blood pressure. High blood pressure increases the risk for heart disease, heart attacks, stroke, and kidney failure. And over the years, there were many studies, over 100 trials that looked at this relationship between sodium intake and cardiovascular disease. And most of those, they found that high sodium or high salt intake will increase the cardiovascular disease and will increase your risk of death. The reality is that sodium intake in the United States and in Europe is very high. The estimated average of sodium consumption in the US is 3.6 grams per day, which exceeds the 2.3 grams per day that is recommended by the US Dietary Guidelines, or 1.5 grams per day by the American Heart Association. There are other studies that looked at what is happening when the salt intake is decreased, and guess what? That will reduce the blood pressure in people with high blood pressure and people without high blood pressure, like kids. The blood pressure reduction as a result of reduced sodium intake, it was greater in Black patients, in middle or elderly patients, and in people with a diagnosis of high blood pressure, but also in patients with diabetes or patients with kidney disease. Dr. Berg also claims that
Salt sensitive people are no longer salt sensitive when they have more potassium.
oh gosh, this statement is an oversimplification of a very complex physiological relationship between sodium and potassium in the body. Salt sensitivity refers to those people whose blood pressure is increasing when they eat more salt, while increasing potassium intake can help mitigate some of the effects of high sodium intake. It is not entirely accurate to say that salt-sensitive people are no longer sensitive when they have more potassium. There are some clinical trials that focused on lowering sodium intake, and they documented that reducing table salt with potassium-enriched salt, not potassium supplements, were beneficial. And there are other factors like diet, genetics, and ethnical background that has an additional role in regulating blood pressure. So my advice, if you have kidney problems and you are taking certain medications, you should consult a doctor before significantly increasing your potassium intake, because taking excessive potassium or potassium supplements does not soften the arteries. Taking excessive potassium can cause side effects, from mild, like muscle weakness, to severe side effects, like irregular heartbeat, severe muscle weakness, and in extreme cases, that can cause cardiac arrest and death. And there are some cases of people that took infusions where they received extra potassium and they suddenly died, like this one. But it is interesting that there are some companies out there that they sell potassium supplements.
You should take a minimum of 10,000 IUs every day. If you're out for 40 minutes in summer, you'll get 20,000 IUs of vitamin D3.
Again, this is half of the truth. If you spend some time, 10 to 15 minutes in the sun, that might produce 10 to 25 international units of vitamin D. If you spend 40 minutes, could potentially produce 25 to 50,000 international units. But remember, these are rough estimates, because the amount of vitamin D that your body will produce from sun exposure depends on multiple factors. For example, your skin tone. The darker the skin, the less vitamin D you will produce. The time of the day. In the midday, the sun is most effective. The season. Summer sun will produce more vitamin D than winter sun. The latitude where you live, because locations closer to the equator might bring you more vitamin D. The cloud cover or pollution, that can reduce the UVB exposure. The type of clothing that you wear, because more exposed skin will allow more vitamin D production. And even the age. Older people will produce less vitamin D compared to younger people. And if you use sunscreen or you don't, again, this will significantly reduce the vitamin D production. But extended sun exposure might also increase your skin cancer risk, or you might get more wrinkles. So, in my opinion, moderation is key. And I know that in the medical community, there is an ongoing debate about how much vitamin D is safe or is it recommended. But first, my advice is to check the vitamin D and to take a supplement only if you are low. Some people say that 10,000 units per day For a few months it's safe, but others do not recommend it. Most of us, we recommend between 2,000 and 4,000 international units per day. But remember, vitamin D is not the cure for everything, and it can cause toxicity. Not toxicity from sun exposure, but toxicity from taking supplements, because vitamin D is liposoluble and it will deposit into your adipose tissue. And the excessive amount will cause toxicity like nausea, vomiting, frequent urination, kidney stones, bone pain, confusion, and even cardiac arrhythmias. So remember, vitamin D is not recommended to everyone.
You've probably been told by your doctor that you need to give up red meat because red meat causes colon cancer, causes heart disease. In fact, out of all of the foods that can help heal you, grass-fed red meat is at the top of the list.
In October 2014, in France, at Lyon, 22 scientists met at the International Agency of Research on Cancer, and they discussed more than 800 studies that investigated the association of cancer with consumption of red meat or processed meat in many countries from several continents, in different ethnicities, and with different diets. And here it is, their official statement. Red meat is probably carcinogenic because of high consumption, and once again, they say high consumption was associated with increased risk for colon cancer, while processed meat is carcinogenic because it was clearly associated with colon cancer. Now, I know there are people out there that do promote the carnivore diet. Now, what is low and what is high consumption of red meat? When we talk about low consumption, this is generally less than 500 grams per week, which means less than 2 servings per week. The moderate consumption is something between 500 and 1,500 grams per week, approximately 2 to 5 servings per week. And high consumption is typically defined as more than 15 grams per week, or more than 5 servings per week.
Next one is that you have to avoid saturated fats. Well, they blame the saturated fat when in fact they should be blaming the unsaturated fat.
Again, this is partially true. Yes, the seed oils are bad indeed because they have a skewed balance between omega-3s and omega-6 fatty acids. But I'm here to say that saturated fats are not all bad, and it all matters the quality, the source, and the quantity. There are good saturated fats in butter, in grass-fed beef, and in full-fat dairy, and that is correct. But there are also bad saturated fats like the trans fats or those fats in the processed foods. Not all saturated fats are equal, and eating too much butter or too much beef, it will lead to bad health outcomes. The American Heart Association recommends limiting saturated fats to 5 to 6% from your total calories. So again, moderation is key. And it is recommended to balance saturated fats with monounsaturated or polyunsaturated fats from olive oil, nuts, peanuts, seeds, and flaxseed oil.
They're mostly going to tell you to lose weight because the weight's the cause. Weight is a symptom. Your high cholesterol is a symptom. The root cause is really something called insulin resistance.
First of all, symptoms are subjective ways for people to explain how they feel. And signs are objective measures like your weight, your cholesterol value. And I agree with some of his statements, but the order is different. Eating too much processed food will increase the weight, and that will cause the insulin resistance. And weight or excessive weight is clearly linked to high blood pressure, to more inflammation, to more gout, or even more autoimmune diseases like psoriasis, like rheumatoid arthritis, and those are diseases that I treat. And I talk about those in my videos.
The next one relates to maybe a recommendation you might get from a dietitian, and this would be you need to be more plant-based.
Once again, he gives you partial truth. Because yes, plant-based processed foods, and I underline that, processed foods are full of unhealthy ingredients. But when a nutritionist is recommending you to go on a plant-based diet, they refer to fresh fruits, fresh vegetables or minimally cooked vegetables and to legumes. And there are so many studies that prove that there is a beneficial effect to eat more plants. Now, people like Professor Christopher Gardner from Stanford University, he dedicated his life to research the role of nutrition and to promote health. And he recently conducted a study that was all over the news. He showed that those people who ate a plant-based diet in just 2 weeks, they had a significant decrease in their glucose level and a decrease in the blood pressure level. In my specialty, there are also many studies in autoimmune diseases like rheumatoid arthritis or even gout that shows that a plant-based diet is beneficial to decrease inflammation. A plant-based diet is rich in fibers and they are better for your gut, for your microbiome, and they will increase those short-chain fatty acids that will promote less inflammation, will make you feel full, will improve the insulin resistance, and it will reduce overall inflammation. And now let's go back and think about the history. What did humans eat for many centuries? For thousands of years, people eat mostly plants. This happened for several reasons. First, plants were easier to find and grow than getting meat from animals. About 10,000 years ago, humans learned to farm, which made it simple to have lots of plant foods. And growing plants also fed more people than hunting animals did. And many cultures and religions taught people to eat mostly plants. So in time, our bodies got even better to digesting plants. On the other hand, for a long time in our history, meat was not so accessible, was either expensive or people could not afford to have it. Because of all these reasons, plants became the main food for humans in many parts of the world. A few things to remember. Most of the doctors that I know do not lie to their patients. Usually doctors make recommendations based on the knowledge that they have at the time of your visit. And I have to admit that sometimes recommendations may change in a few years as we learn more about the human body, which is a very complex machinery. But until then, our recommendations come from many years of school, usually about 4 years in college, 4 years in medical school, 3 years in residencies, and 3 years in fellowships, and sometimes even more. We pass many certification exams and from years of working with patients, because there is no better way to practice medicine than learning from our patients. And videos like this one are a perfect example of how easily facts can be mixed with speculations, which can lead to confusion and potentially harmful decisions. Don't let these half-truths to cloud your judgment, and don't let them make you take an emotional decision, because today is more crucial than ever to question what you see, what you hear, and to seek out reliable sources and consider multiple perspectives. And always dig deeper, whether it's a viral trend or it's a sensational news story. And now that I have discussed the scientific truths on all of these so-called lies, you should watch this video where I teach patients about the value of certain supplements for autoimmune diseases.